Again, thank you for joining us today. We're going to discuss the arrival of the COVID-19 vaccine in Oklahoma. We're planning for the storage and distribution of the vaccine by Pfizer and Moderna, and any other vaccines as they come available. The first doses of the Pfizer vaccine will arrive soon in Oklahoma. We expect the EUA to be approved as early as December 11th, which means the vaccine would be shipped and be arriving the first part of that next week, or the 13th or 14th. We would receive follow-up vaccine at a regular cadence after that, and so that's just the initial dose, but we expect weekly or biweekly doses shipments after that. The Moderna vaccine is expected to be available shortly after that, probably around the end of December, but we'll confirm the date once we receive additional information. Initially, Oklahoma will receive 33,000 doses of the Pfizer vaccine, and we believe approximately 10,000 doses of the Moderna vaccine. We want to make it clear, again, that this does not mean that the general public will have access to the vaccine at that time. Those initial doses go to our phase 1 people, which are the most risk population that will be on the front lines, and included in that are groups such as healthcare workers, long-term care staff, and residents, and public health staff that will be out there giving the vaccines. We anticipate the general public will have access to the vaccine in the first part of 2021. To you, Jackie.
Great, thank you so much. Keith Reed, our Deputy Commissioner, has some kind of follow-up details to fill in.
Good morning. Yes, I'll provide some additional information on the vaccine distribution plan. Please note that we're continually working this plan and making adjustments as new information from the CDC and Operation Warp Speed is provided. Flexibility has been a key element of our approach, and as such, changes may well occur between now and vaccine delivery. To ensure our priority populations are the first to receive the COVID-19 vaccine, predetermined sites have been identified around the state that will receive the initial vaccine shipments. These sites were selected based on strategic location, ability to meet storage and handling requirements of the vaccine, including the ultra-cold storage you may have heard about, and their willingness to participate in the program. From these initial locations, vaccine doses will be redistributed to select primary care health systems and through our county health departments based on a hub and spoke model in order to more effectively reach key populations across the state. We'll roll out the CDC approved distribution plan as soon as the first doses arrive, which again, we expect as early as December 11th. I do want to clarify expectations though. The 11th is the earliest we expect it. Additional information received today indicates it could also be as late as the 14th. This is as an example of an ever-changing environment where our planning must remain flexible. We also expect to receive supplemental shipments, as Dr. Fry mentioned, on a 1 to 2 week cadence following the initial shipment. We have developed a team of representatives from OSDH and the Oklahoma National Guard to plan and implement the logistics of this endeavor. The COVID vaccination program team will be actively supporting local public health and provider efforts to ensure the vaccine is available throughout the state. Project managers in local jurisdictions are currently working with local partners to plan for clinics and strike teams. Once the vaccine is received, vaccinations will begin with frontline healthcare workers. This effort will occur in partnership with healthcare organizations. We are focusing on acute care hospitals treating COVID-19 patients first. In the days following initial vaccinations in acute care facilities, remaining vaccine will be redistributed to our public health districts around the state in a continuation of the hub and spoke model. Doing so will move vaccine throughout the state to reach our priority populations, regardless of location. Please keep in mind that an effort of this magnitude will not happen overnight. It'll take some time, and our efforts will continue over the days, weeks, and months following initial receipt of vaccine. We ask for patience and understanding as we progress through this very complicated endeavor. I want to reiterate that we will ensure all Oklahomans, particularly rural communities, are able to access the vaccine as it becomes available. In its feedback, the CDC emphasized that collaboration between statewide partners and local partners was a strength in Oklahoma's plan. Again, we will lean on Oklahoma's collaborative spirit and strong partner relationships to collaborate with hospitals and healthcare professionals across the state, particularly in rural communities, to ensure priority groups are able to access the vaccine regardless of where they live. It is important to note that Pfizer COVID-19 vaccine, which is the first that we will receive, requires individuals to receive a 2-dose regimen. This first shipment includes the first dose only. The second dose will arrive at a later time and will be distributed to Oklahomans as outlined in our phase plan. This portion of the plan is being managed by Operation Warp Speed and eliminates the need for us to hold back inventory to meet the second dose requirement. In addition to healthcare workers, there's currently also a plan for long-term care facilities to receive their first dose of the vaccine through a different allocation from the federal government and through a partnership program with specific pharmacies. This program is planned to follow initial implementation by 1 to 2 weeks and then run concurrent to our state's efforts. With that, I will turn it back over to Commissioner Fry.
Thank you, Keith. We want to remind everyone that though we're very enthusiastic about the arrival of the initial doses of the COVID-19 vaccine in our state, this won't be an immediate solution. It is vital that Oklahomans continue to take precautions to slow the spread. Everyone should continue to wear a mask, wash their hands, and watch their distance as ways to truly prevent the spread of the coronavirus. These actions, in conjunction with the vaccine, can make a huge difference in keeping our families and communities safe and healthy in the long term. We urge you to work together now as you have in the past, but really work together now so that we can help decrease the spread of this virus. You know, if we do all this in conjunction, we are very enthusiastic about the outcome of this. As you heard Deputy Commissioner Reed speak, you know, we're very positive about this vaccine. So far, the information that we've received about the safety and efficacy of it is outstanding. I think it's going to be a game changer for us here in Oklahoma and throughout the world. So we're very, again, enthusiastic about it, but we all have to continue what we can do to decrease the spread, because we have the highest numbers and the highest community percent positivity that we've had throughout this pandemic right now. And at that, I think we'll open up to some questions.
Jackie, did you have anything else you wanted to add as far as the plan or anything before we do questions?
I do not. I think we're ready for some Q&A.
Perfect.
Thank you.
So I know there's a lot of people on. If you want to put your questions in the chat, we can start from there. I know Barbara mentioned you have a question. If you want to go ahead and ask it here, you can.
Okay, thank you, Anthony. My question is, what does John Q. Public do to receive this vaccination? Do they need to contact their local doctor, or how is that going to work?
I'm going to let Deputy Commissioner Reed answer that question. He's been working on this. Go ahead, Keith.
Certainly, and that's a very good question. We are starting out with a phased approach with priority groups, and these priority groups are associated with organizations, primarily healthcare organizations. So communication to those individuals on the logistics of receiving their vaccine will occur through their organizations. When we start to expand this program out, it's important to understand that we're looking at adding in pandemic providers around the state. Our anticipation is that when we get further into this and start opening up to other phases, we will have a large network of providers around the state that will be able to provide the vaccine. We're not depending on the public health system alone or large health organizations to be a venue to receive the vaccine. As we get into other phases, we will put out specific communications to those categories of the public to notify them of where they need to go and when they need to get their vaccine, we will have an interface for them so that they can go online and get their appointment and basically register for an appointment and to get their vaccine. So we have a communication plan that will trickle down as we get into the phase of the plan that gets to John Q. Public.
Thanks, Keith. Cassie, I believe you had the next question, then we can go to Chris Polansky.
Yes, thank you. I just have a quick question about how storage will look. Did the state have to buy new equipment or storage to keep those vaccines at those very cold temperatures? Is it centralized in one facility? I'm just curious about what kind of hurdles, if any, the state saw with that.
Yeah, we didn't have to purchase any new items. We did have a foundation donated 11 ultra cold storage facilities for us so that we could place those in all the districts around Oklahoma so that we could have that hub and spoke model. We also had in Oklahoma we already had several places that had the ultra cold storage facilities. And so we just capitalized on those and we're all working together to distribute from those centers.
Chris Polansky.
Thank you, Anthony. Thanks everyone for being on. I was wondering if there is, and this is for both this first phase of distribution as well as moving forward, is there a specific or dedicated campaign with a plan and with money behind it to promote the vaccine, the safety of the vaccine, promote folks who may be reluctant to get the vaccine? And as just a quick add-on to that, is there an internal goal for % of the population you want vaccinated?
Both of those are really good questions, and I'm going to let Jackie talk some about the communications piece. But I can tell you on the vice president call, they stated that initially their first survey said that about 50% of Oklahomans would take it and 50% wouldn't take it. The sentiment and I guess faith in the vaccine has increased considerably since then. They did a survey not too long ago that showed that only a third of Oklahomans now, in the United States, a third of people in the United States have concerns about the vaccine. 2/3 said they were anxiously awaiting it. So I think it's getting better, and we've heard some promising information as well. On the same call, for instance, on the Moderna vaccine, they said that in the trials, they only had 30 people who had what they considered severe reactions, and all 30 of those were in the placebo group. So none of those reactions were in people that actually got the vaccine. So incredibly promising news, and we certainly want to get behind that and make sure everyone is getting that information. Jackie, can you talk about our communications plan?
Sure, and we're currently distributing a survey statewide just to understand better sentiment of Oklahomans and their willingness to receive the vaccine as well. And so that'll give us a better idea. But we also will be relying on the professionals within the healthcare professionals within the Oklahoma State Department of Health and our healthcare partners to speak on vaccine efficacy, and happy to share any information that we receive from the federal government on the efficacy as well. We'll be developing a strategy with our healthcare partners to really speak on that as well as we move forward with distribution.
We also have tomorrow we have another meeting with Google to hopefully be able to finalize some plans with them, and they have a robust ability to do surveys and also do media communications as well. So we're hopeful that that's going to be a big benefit to us.
Thank you both.
All right, next up we have Tiffany with Fox 23, and then we'll go to Carmen with the Oklahoman. Tiffany, are you still on?
Tiffany, it looks like you're muted.
Sorry guys, my bad. Thank you guys so much for allowing us to ask some questions and for giving us some insight. One question that I'm getting a lot from viewers, and I think obviously it's great that Dr. Fry, for you to be able to line out when most Oklahomans can expect to get this, but I don't know if this is a question for Jackie or maybe for Keith. Can you talk about the difference in the vaccines, since we know that a lot of Oklahomans, and specifically that phase 1, will be getting, some will be getting Moderna, hopefully both get immediate FUA approval, but EUA approval, but what's the difference in terms of that, the vaccines? And we know the efficacy is really within a couple percentage points, but what would you say is the difference for those wanting to know at home? And then secondly, I wondered if any of you guys could, I emailed yesterday to ask about it, but the difference in the death rate between the CDC and what the state is reporting right now, it's a pretty substantial number. Yesterday it was 358. I haven't added in today's numbers that have come when we've been on the call today, but if you can help us understand that so we can explain it to our viewers. So I think we're getting a lot of questions about that right now. Thank you.
Sure. And I'll let Keith answer those. I will say that they're both messenger RNA vaccines. The stabilization, what they use to stabilize that is different in them, and that's why there's differences in the storage requirements of them. But Keith, why don't you go ahead and give more details?
Sure. And as mentioned, if you're in the public and you're trying to decide between these vaccines, I don't think there's going to be much at all that's going to steer you one direction or the other. Again, safety, efficacy, all that is very comparable. I think what is important to note, however, is that because of the different requirements for us to store these vaccines and the logistical challenges with Pfizer, we will be directing certain manufacturers towards certain populations. As an example, Pfizer comes in what they call a pizza box, and it's to maintain the ultra cold storage, which is around -70 to -80 degrees Celsius. That comes with 970 doses inside that. Once we open that up and start administration of that, we essentially set the clock on the viability of that vaccine. So in doing so, we need to gear and direct that vaccine to larger populations that we can process very rapidly. And that's one reason we are focusing on our large healthcare systems first, and then using a hub and spoke model so we can very carefully manage that vaccine logistically. The last thing we want to do is waste vaccine because we fell outside of a very limited timeline to be able to use it. The Moderna vaccine, which is going to be following quickly on the heels of the Pfizer vaccine, has a lot more flexibility with this. It's standard frozen temperatures. It comes in shipments of 100 doses. It gives us a lot more flexibility and mobility on using it and maybe doing more mobile type of distribution sites. So that in essence is going to drive what is available to certain parts of the population. And then on the question about the deaths, Commissioner, I was going to refer that one back to you.
Tiffany, can you restate that? I'm sorry, what was the exact question on that? You're muted, Tiffany.
Yeah, I'm sorry. I just checking with you to see. So the difference, there's a discrepancy in death reports for what the Oklahoma State Department of Health is reporting and what the CDC is reporting. And as of yesterday, and I haven't factored in, I know the new numbers just came out with like 25 more deaths or something. I just glanced at it. But as of yesterday, the difference was about 358. And we have seen that number grow in like the last week. And so we're just getting questions about why it is different. And so I know sometimes there's a lag in reporting with deaths, but just, I guess, if you can help us understand why the CDC would have those numbers already posted, or if there's a different process for the state, or why is that number so different?
Yeah, and I don't know the exact reason. I can tell you some things that go on with the death numbers that might be a part of that. I know there is often a lag. They usually get their information from us, so it should line up eventually. However, we do once we get the numbers, we actually go through and look at those and try to confirm whether they were actually from COVID-19 or not. So, we don't want to classify something as that if it's not correct or appropriate. So sometimes those numbers change in the end, and that might have something to do with it. Obviously, it's not like, labs are required to report all that information to us as far as testing numbers and all that kind of stuff. So those are dependent upon, when the specimen's collected, when the test is done, everything. And so it's not real time. There's a little bit of a lag to it, but deaths don't come in that same way. I mean, they're reported by multiple different means, and it's very dependent upon when does somebody finally sign that death certificate or fill out the information. I know as a physician, unfortunately, I've had to do that many times. And sometimes that gets up to the floor for me to sign when I'm not in town anymore, and it takes a while for me to come back and sign it. So certain situations can delay that. And so those are spread out over a period of time. And then for some reason, we'll just get a bunch of them in on a certain day. And so we post them on the day that we get them, but that number can change.
But you're saying that you're saying, Dr. Fry, that you would expect that those numbers will line up eventually?
It depends on what, I would hope that they will. I don't know where they're gathering that data as far as where in the process. So I don't know if they're actually going through getting them at the stage where we've actually gone through and made sure that they were actually COVID-19 related. And so they could be getting them earlier in the process or later. And so I honestly don't know the answer to that. But the numbers we give are to the best of our knowledge, ones that we've verified and made sure that they were from COVID-19.
Okay, so I don't know if there's a way that we can find out that it's not a couple of deaths. I mean, because it is now almost 400, I think there is a concern. Obviously, it's impacting our rankings. It's impacting the COVID tracking reports. It's impacting the White House reports. So now that it is such a discrepancy, we are seeing that impact. So I guess if the CDC is over-reporting, then we need to be able to reach out to them and ask them if they're adjusting our numbers. So I guess just what should we know going forward?
I'll pass that on to the people that actually do that and have them look into it.
Awesome. Thank you very much.
Sure.
Yeah, and I know, Tiffany, we have that question out to some data people at OSDH, and they're checking that as well. So I'll be sure to send that your way if that comes.
Awesome. Much appreciated.
You're welcome. So keep moving on. Carmen, and then we'll go to Ryan with KGOU.
Yeah, thanks again for doing this. I think my question's for Keith Reed. So the state's plan says that long-term care and nursing home workers and nurses there are the first to get it. But it sounds like, you talked a little bit about how those workers will get vaccines through a different means, and that if I understood correctly, it sounded like frontline workers, healthcare workers in hospitals, that sort of thing, will get first dibs. And then the nursing home staffers and all of that will come a couple weeks later. I guess I was just a little confused. So if you could clarify, that would be helpful.
Certainly. Yeah, I'll be glad to clarify. So both these groups, both frontline healthcare workers and long-term care staff and residents, are in our priority 1 groups. So they're both part of our priorities. The federal government, through Operation Warp Speed, has contracted with some large national pharmacy chains to provide vaccine direct to long-term care staff and residents. The way it looks at this point, that vaccine will be Moderna vaccine. And again, keep in mind, I preface some of my comments about the flexibility and how the information does change, and this evolves with information we get from the federal government in Operation Warp Speed and CDC. So what it looks like at this point is that they're going to use Moderna vaccine in order to get to those long-term care centers. That makes sense in that many long-term care centers are not going to have huge numbers of individuals that require vaccinations. When you count residents and staff, you're looking at a program that fits better with the logistical ease of a Moderna product versus the complex need of a Pfizer product. Unfortunately, we've had to adjust planning based off of realistic limitations with storage requirements, shelf life, and factors such as that. So as soon as we have already notified the federal government that we want our long-term care residents and staff, we want that program implemented as soon as possible. So we are set for that to be kicked off as soon as it is delivered from the federal government to those pharmacies. That will likely be a 1 to 2 week follow-on from our initial vaccination of our frontline healthcare workers in acute care settings. So we're not trying to put them off at all. We want them to absolutely be our priority. Unfortunately, the logistics of the COVID vaccines that have been given to us is going to dictate some of the sequence in which that we give some of these vaccines. And we want to maximize the use of our federal partners and the federal resources that they bring to bear on this, and also the fact that we will be using some of their allotment without reducing our allotment for the state. I hope that makes sense.
Thanks, Keith. Ryan with KGOU, are you on?
Yes, thanks, Anthony. So I had a couple questions. The first thing I wanted to ask is, I noticed that the state is getting 3 times more Pfizer vaccine than Moderna vaccine, but it sounds like the Moderna vaccine is definitely going to be going to rural areas, smaller, facilities that can't go through a full pizza box of vaccine in one go. And so I'm wondering if you're going to continue to have less access to the Moderna vaccine, and if that's going to create a backup vaccinating these groups of people. And then to sort of follow up on that, I know if the Moderna vaccine isn't available, what's the plan?
So good questions. I will first want to say, again, a very evolving plan. The information we get daily, we continually tweak our plan based off of new information we get from the federal government. As an example, just in the last day or two, we were told that the number of 10,000 as expected for Moderna is probably a very low number, and it could be up to 6 times higher than that, to give you an idea of how that changes. So the numbers for vaccine, I wouldn't put a lot of stock in that and consider that to definitely be a third of what we intend to receive on the first shipment of Pfizer. It may well be twice what we're expected to receive from Pfizer. And then in addition to that, that planning to include the amounts that we get is taken into consideration that some of that needs to go to this long-term care program as well. I also want to clarify, when I talk about Pfizer and the pizza boxes that have 975 doses on those, that does not mean that we cannot use Pfizer to go into a facility that maybe has 200 or 300 people in it. What it means is that we have to be very, very deliberate in our planning so that when we pull those number of doses from that stock of 975, that we know that we have a destination that we can get to and that we can fully execute implementation within like a 6-hour window. So it's not that we can't go into these facilities. We just have to be very, very careful and very deliberate on how we execute that plan. And that's really been the crux of the challenge for putting together a good plan for COVID vaccination.
And is that equally possible in areas that don't have facilities on the order of 200 people, where it's, a nursing home that has 20 people in a rural area with similar capacity around? Is it equally possible to get the Pfizer vaccine in those areas, or is there a point where there's sort of a hard limit where you say no, there's not enough population density, there's too much potential for waste?
It's something that we have to take into consideration, but if we plan well and we can have multiple sites, it may be a case that we have to reallocate human resources to those areas so that we can send out multiple teams using this hub and spoke method to deplete an inventory and get it into multiple locations at once so we can work with smaller numbers. It's a challenge that where we have to micro plan and get down to that local level. And it's not going to be easy. And I think we need to be realistic and understand that the logistical limitations of Pfizer does have the potential to limit some of our decision making or guide our decision making. And we feel very confident that the Moderna vaccine is going to be right on the heels of Pfizer, and in doing so will give us a lot more of that flexibility. But we're not going to leave rural areas out of the mix if we have an issue with the Moderna vaccine. We simply adjust our plan and we shift resources to make sure that we can compensate for those limitations.
Wayne Green, I know you have a question if you're still on, and then there's one before about the distribution plan. We'll get that to you if we haven't already.
So thank you for your time. As I understood the story in Oklahoma Watch, the second phase would include our prison inmates, and then educators would be in the third phase, which I understand the need to set priorities. But is there a route to the front of the line for compelling reasons? So, I mean, if you were a 64-year-old school teacher, special needs school teacher with asthma, can you get bumped up for compelling reasons?
It's a great question. So this is a very fluid and changing environment. We understand that, you know, a 20-year-old teacher is not the same as a, 67-year-old teacher with multiple comorbidities. So, we absolutely understand those situations, and we'll be able to try to adjust and do what we need to do. However, we brought in an independent panel that we put together of advisors on how to come up with the distribution plan. Who should get it first and who should get it second. And it's actually quite complex on how they decide. And CDC put out their recommendations, HHS put out their recommendations, and but then they left it up for us to decide on how to do that. But our plan pretty much aligned with everyone else's recommendations after this independent group of people came back with their recommendations. So we are obviously going to try to follow that, but there's no hard lines there either. If we show up with 1,000 doses of a Pfizer vaccine and we only have 800, healthcare workers there, guess what? Whoever's around is going to get that other 200 doses. We're going to obviously trying to prioritize and make sure that we get the highest risk people first, but we're not going to waste any vaccine either. So.
Did I understand the story from Oklahoma Watch correctly that prison inmates are priority 2, educators are priority 3?
The congregate living is one of the highest risk, and I think that's probably why they're fitting into that section. But we've also there's been some interaction with the CDC about wanting to change the guidance on, for instance, teachers. They're wanting if we can, because we also understand the importance of keeping our kids in school and keeping everyone, keeping the teachers safe and secure would help with that. And so there has been a push to try to get them to change the recommendations on where teachers should fall in that category. And so it's an ever changing plan and part of the puzzle. And so there's probably more to come on that.
Thank you.
Sure.
Thanks, Wayne. Phil, Reed, and then we'll go to Walter.
Hi, yes, thank you. Philip Reed with Reed Newspapers. Can you hear me okay?
Yes.
Good. So I'm not sure if it's premature at this point to discuss John Q. Public, but we are getting a lot of questions on our feed here regarding the accessibility. Not only the accessibility, but potentially the price. Are we premature in discussing that? And then do we think that the distribution will go through primary care providers more, or through the health department, or some other vehicle?
Sure. First of all, that's not premature, and I'm going to let Keith talk about the details of the plan. But I will say that there is no cost of this vaccine. The federal government is providing it at no cost to everyone. And Keith, can you talk about the details of that?
Certainly. So part of this program is that we are recruiting and signing up what we call pandemic providers. And these are people in the healthcare system around the state, anything from a large healthcare organization to a private provider in small town Oklahoma. And we are recruiting them to sign up as a pandemic provider that gets them into our immunization, signed on to our immunization registry so that we can help track delivery of the vaccine. We're recruiting them in. We have hundreds that are in the queue that we're processing right now. The plan is when we have sufficient volume that this will roll out to those providers. And ultimately, we're looking at direct shipments to these providers. And so I expect as we get further into this, that John Q. Public will be able to get their vaccine. They could possibly get it in a larger distribution pod that the health department might sponsor, or they could get it from their individual providers, as long as their providers sign up with us as one of our pandemic providers.
So, Philip, this is something that you can all help us with. You know, we have a lot of rural areas to our state that may have only one or two providers for quite a large area. We need those providers to sign up. We're not allowed to ship vaccine to them unless they've signed up for this program. So we need them to do that.
Thanks, Dr. Fry. I know we have about just over 15 minutes left. We'll try to get to as many questions as we can. Walter, are you still on?
Yes, I am.
Okay.
This is Walt Swerko from K10 News. Are these distribution centers the spokes of your wheel? I'm assuming they've been identified. Are they publicly identified? Can you say what cities and communities have these spokes in your wheel?
It's a great question, and you know, we are not we have them all identified and they know who they are, but we are not releasing that as of yet, just because of security reasons. We want to make sure that they that everything's done, you know, without any interference, and we want to make sure that it's done safely. And they will be released as soon as we're able to give that information out. But right at the moment, we're not able to.
What kind of security is being supplied? Is it police? Is it just security guards? What goes into securing these vaccines?
Well, it's just an overall. You can imagine at a there are probably multiple security factors that you have to concern yourself with. You know, if maybe, you know, you've got one person in a rural area that's got vaccine, and you've got a lot of people that want that vaccine, and maybe they've only got, you know, 200 doses. So, you know, we just want to make sure that we're doing things in a proper and secure way. And, you know, as soon as we can get that information out to everyone, we will.
Just one follow-up to that. Do you feel that the security aspect of it might make some potential providers feel unsafe? Maybe they don't want to take part in it, in the program, because of any potential risks involved?
I don't think so. I mean, I'm a healthcare provider myself, and these people are, you know, frontline battle of this pandemic, and they are very excited and very willing to do what they need to do to make sure that this vaccine gets distributed.
Thank you.
All right, up next we have Erica with News 9, and then we'll go to Janelle. Erica, are you on?
Yes, sorry. Okay, many healthcare workers are hesitant to receive the vaccine. With the EUA, it is not mandated frontline workers get it. What would you say to a healthcare worker that is on the line deciding whether or not they will get it?
I would absolutely get this vaccine. I have no hesitation personally about taking it, and I would highly encourage them to do that, because we don't want any more deaths in our state. We don't want, we want to keep our personal health and our economic health and our mental health all moving forward and get as back and close to pre-COVID life as we can. And I highly promote this vaccine. I don't have any hesitation at all.
And when will the second doses arrive for those who get the vaccine first?
I can answer that. So the way it's set up, Operation Warp Speed is setting up a automatic shipment regimen so that once we get vaccine, so the first 33,000 doses, for example, they are automatically scheduling a second shipment of 33,000 that will be followed within 21 days of that for the purpose of us administering this second dose. So this is in a logistical system that's managed by Operation Warp Speed.
Thank you.
Thanks, Erica. Janelle, are you on still?
Yeah, I'm still here. I just have a couple questions regarding the timeline. When are you expecting to have this vaccine widely available to the general public, or you're having to aiming to have the majority of the population vaccinated? Also, when are you aiming to have nursing home residents and staff fully vaccinated, and will the vaccine be optional for those residents and those who are in prisons?
All good questions, Keith. You got the numbers of people that need to be vaccinated when and all that stuff, so I'll let you run through that. But in general, we're probably looking at first quarter. I'm saying first quarter of next year for general public. It might be spring before they get there. I know the DoD just came out with their recommendations, I believe, yesterday, as far as what for them to expect, and I think theirs was probably going to be in that same time frame.
Yeah, I would just add on to that to give you an idea of scope. Our priority 1 groups make up about 115,000 Oklahomans. Our priority 2 groups are about 763,000 Oklahomans. And then that third priority group is the largest group at about 2.5 million Oklahomans. There are multiple factors that are going to play into answering your question. One is the rate at which manufacturing and delivery keeps up, of course. And we are assuming that getting into the first of next year, we hope to have sufficient vaccine to maintain normal, uninterrupted operations. In other words, we don't anticipate having lulls to where we're waiting on inventory. If all goes as presented, I believe we will have sufficient inventory to maintain operations, but it takes time to immunize that many people in the state. And then the other factor is the uptake, is the number of people that are interested in getting it and accept it. That will help determine how quickly we move through the different phases and get to just the general public.
And please, everyone, remember, it requires 2 doses that are basically about 21 to 28 days apart. So, it's going to take a little time. You might receive your first dose, but it's going to be a month before you get that second dose, before you're fully immunized and vaccinated. So,
just one other thing. For the people who are living in nursing homes and also in prisons, are you guys going to mandate that for them? Because I know they're among the high-risk population. Or is this going to be completely optional?
we're not mandating anything. I know that individual facilities can take a different action. For instance, I can't work in any hospital unless I get a flu vaccine every year. So, you know, that because those hospitals say, if you're going to work at our hospital and get privileges here, we want you to be vaccinated because we don't want you giving the flu to a patient that's high risk. So, you know, individual hospitals have the ability to do that. Individual long-term care facilities have the ability to do that. Department of Corrections has the ability to do that, but we're not going to mandate it as a state agency.
Thanks, Janelle. Chase, I know you're up next, and I feel like the question has been asked already by Tiffany regarding Oklahoma state numbers versus CDC numbers, and we're looking into that, so we'll get back to you on that. I don't know if Chase.
I do have one other question, if I can go ahead and ask. I know Commissioner Fry, the Nurses Association has a upcoming press conference, and as soon as you get wrapped up, can you talk a little about your meeting with them, your recent meeting with them, kind of how that went and where everything stands with that?
Yeah, it was actually a very good meeting. We are, you know, trying to work with them in any way that we can from a state level to help them with their need. You know, there are limitations on that. You know, as a state agency, for instance, us trying to control a labor market, you know, is not something we can do. But as much as we can give them support or help them through this process, we're going to, and I think that's more to come when you see the upcoming press conference. But it was a good meeting.
I believe Laurel is next, asking about EMS considered frontline providers in the first round.
Thank you. The CDC originally, or in their report, said that EMS was specifically listed, but we're getting some conflicting reports on what Oklahoma is going to consider. That's my first question. And then second is, in a lot of the rural areas, EMS includes other responders, which would be police and fire, providing medical first response in the community. And would there be any consideration for those responders that provide medical care besides your traditional EMS services?
Well, I'll be glad to answer that. At this point in our plan, we have first responders, which would also include law enforcement, as you mentioned, along with, you know, law enforcement, fire, and EMS. And then EMS also crosses over into some of your healthcare frontline providers as well. We have them listed right now on the priority 2 groups. I do want to remind everybody that our priority 1 groups is your healthcare providers providing direct COVID care. A lot of your EMS units are affiliated with a healthcare system, and as such, they could be included with that healthcare system if they identify them as part of their population that they want to give initial doses to. But I also want to remind everybody that the priority 1 group is by far our smallest group. As I mentioned, in total, it's about 115,000 Oklahomans, and that's assuming that every single person was to accept a vaccination. And then I also want to mention and remind you that long-term care is a part of that group. And if that's covered through the federal pathway, then that further reduces that number. My point is that when we talk about priority 2 groups, we're talking about a pretty thin line between shifting from phase 1 to phase 2 into that group. I anticipate they're going to be there very quickly with that first echelon of people getting vaccinated. And in some cases, they probably will be included with that first group through their affiliation with hospitals.
Okay, I know we have just about 3 more minutes left. We could probably take a couple more questions. Dillon and then probably Lindsay. Go ahead, Dillon.
Hey, can you hear me?
Yes.
I've got 2. The first being, we've seen a pretty dramatic drop in our 7-day average of new cases over the past week or so. Commissioner, you think that's due to reporting changes over the holiday? Do we think infection is slowing down? What do we think is going on there? And then I have one other as well.
Great question again. And I think my answer is it's too early to tell. You know, we are, We still have a little bit of the holiday in our 7-day, 7-day rolling average is still had definitely affected some of those numbers early on, and still may have a little bit of effect now, just because if people aren't testing, we're not going to know, and not as many people probably. A lot of people tested right before the holidays. I mean, we had the largest numbers of tests run daily for quite some time leading up to the holiday, but through the holiday, of course, those numbers fell down some. So I hope that it continues, but I'm always a little cautious and would like to see a few more days of numbers.
And then my other one for you, Commissioner, I know, it's hard to predict this kind of thing, but now that we have a little bit more clarity on the timeline of the vaccine, I think a lot of people are wondering, by next summer, will we be, if not totally normal again, pretty normal again? How will things look, do you think, next summer? And can people gather, that kind of thing?
I think it's going to be a lot different. I think that I'm very hopeful that we will be back to as close to normal as we can. I just want to remind everyone that this virus is not going away. We're probably going to have it. It's probably going to continue throughout our communities, and it may mutate and change just like the flu does. We may have different strains that come up, and that might require some tweaking of the vaccination and revaccinating, just like the flu would. So we don't really know. There's a lot of unknowns out there, but no doubt this vaccine is going to change the way we are doing things now, and it's gonna make things a lot better.
Thank you.
All right, I know we're pretty much at time. I want to make sure at least one tribal question gets in. Lindsay, are you still on?
I am still on. Thank you very much for including me. So, gentlemen, asking on behalf of both Osage News out of Pawhuska and the Citizen Potawatomi Nation's HownieCon, you've mentioned a couple of times that IHS will be getting vaccines, IHS facilities will be getting their vaccines through the feds. However, the Department of Health and Human Services has put out guidance that tribes with self-determination contracts such as Osage, Citizen Potawatomi, and Cherokee Nation have the option of going through the state of Oklahoma, through their respective states instead. How many tribes have reached out to OSDH to get their vaccines through the state? And is there any are there any geographic trends to that? Are they all specifically from one side of the state, or are we all talking smaller tribes or anything to that effect?
I'm going to let Keith talk about that some, but I will say that our tribal partners have been incredible partners throughout this whole response. For instance, normally to use their services, you would need to be a member of their nation, right? But let's talk about testing, swab pod sites. They opened up a robust testing center and tested everyone. It didn't matter if you're a tribal member or not. They opened up to the public. So I'm expecting similar things from them with this, and of course, we never turn away anybody. So we're happy to vaccinate or test anyone. So, but Keith, would you give her some more details, please?
Certainly. IHS, I just want to mention IHS and our tribal partners from across the state have been very much involved in our planning and discussion on this. Early on, when that option was put out by HHS, there was a lot of debate among the tribes whether they wanted to go that route and receive their allotment through the IHS federal allotment system or work with the states. They chose, the majority of them chose to get it from the IHS side, the federal allotment. But in doing so, we were very clear that our agreement was that we weren't going to put up walls, and we weren't going to say, okay, you made that decision, so you're out of our plan. You're no longer a partner in this. So while they are receiving their allotments through the federal government, as the commissioner said, we're not putting a wall up and turning any tribal members away that come into a health department and meet our priority populations to get served. And we know that they will reciprocate that with us to the degree they can as well. And as far as the specific numbers, I'm going to have to get back to you on specific numbers on how many. To my knowledge, all the major tribes that had their independent health systems went with the federal allotment, but I'll double check on that to make sure.
Thank you very much, sir.
You bet.
Okay, I know we're pretty much at time. I want to be respectful of everybody's time. So there's a few questions probably still in the comments. We'll be sure to take note of those and get back to those via email.
Anthony, can we just ask a quick question? The email for today's update, sorry, since we've been on the call the whole time, just now looking at it, it says 25 deaths, but the site says 24. So I just noticed the discrepancy, just checking to see if it is 25 or 24. Do we know?
I'm not sure, but we can look into that.
Yeah, Tiffany, I don't have that information with me right now, but we'll look into it.
Thanks.
Thanks, everybody.
The report I got, Tiffany, the report I got was 24. I'm looking at it here, but we'll double check and see why there's a discrepancy.
Okay, much appreciated. Thanks so much, Commissioner.